We'll give it, we're at 3:33. We'll go ahead and move on. If you guys have not had a chance to do the Slido, Carrie put the Slido poll number in the chat and you can access that at slido.com. So to launch into today's presentation, we actually had Marita Landreth, who is the Director of Behavioral Health Coordination with the county, reach out and wanted to know if we wanted to give her the space, or she requested the space, just to let us know some of the updates of what's been happening with the reconfiguration of the Behavioral Health Coordinating Council. So she's going to go ahead and give us some updates on that and also where things are looking to go in that direction. So, Marita, I'm going to turn it over to you and give you screen sharing privileges.
Awesome. There we go. Share. Okay. Can you guys see the slide?
We sure can.
Awesome. Okay. All right. So as previously mentioned, my name is Marita Landreth. I've been a part of the county's behavioral health coordination team for the last 4 years. I started as a nurse for the FUSE program, which we'll talk about a little bit, and started as some version of director. I started interim in April of this year and formally started the job in June. Yes, June of this year. And there has been a lot going on, and since probably about March, there's been a lot of upheaval and stuff going on. And sometimes I've been able to answer questions, and sometimes I haven't. And things are finally actually starting to settle. And so I wanted to take an opportunity to kind of share some of those things and just get an opportunity to talk just a little bit about the department because it's nationally even the way this is broken up is fairly unique, which we'll get into here. But I just wanted to have an opportunity to just share this with everyone. Okay, let's see. Why won't you do what I tell you? There we go. Okay. So my intent today is to explain a little bit about the role of this group, both historically and presently. To provide some context for some of the changes that have happened, and then provide awareness to a lot of you folks, to frontline members of the organizations that are involved in some part of the coalition that behavioral health coordination supports, so that you can know how you can contribute to this work with or without having membership so far. So unfortunately, first we're going to go into a little bit of history, and that's because I had to dig into this history to understand my place in all of this, and I've actually found it kind of useful. So this all started in 2009 when there was a push locally to improve mental health care for incarcerated folks. The McLean County Circuit Court ended up creating a criminal justice coordinating council. That is something that still exists. I believe that is still part of the county, so those should be, I believe, I'll have to double check and see if those are open meetings, if those are actually open meetings. But the Criminal Justice Coordinating Council still meets quarterly. And that's kind of what got us started talking about these kinds of things. Around closer to 2014, a committee of the McLean County Board got together some work groups to start to plan, evaluate, and coordinate mental health services beyond the jail and in the larger community. Those work groups and reports ended up resulting in the first mental health action plan, which happened in 2015. It's gone through a couple of updates. These are just a couple of slides of kind of what it looks like today. So the mental health action plan is very robust. It's very big picture. It has a lot of data running through it and is an excellent bathroom read if you're ever looking for something to distract yourself from the existential dread that happens when you don't have a phone or something to look at when you're on the toilet. But it is the guiding document that we use for our department and the coordinating council part, for sure. So around that same time, around 2015, excuse me, 2016, the board established the Behavioral Health Coordinating Council as an ad hoc county administered group that reported directly to the county board to implement that mental health action plan and to advise the board about what those next steps would look like. Around the same time, the town of Normal, the city of Bloomington, and McLean County entered into an agreement, an intergovernmental agreement to set aside 1% of all the sales tax in McLean County to fund mental health and public safety initiatives. That money does get split up into a couple of buckets. If you count all McLean County sales tax, that mental health and public safety fund is 1%. And then a quarter of that 1% is what feeds Behavioral Health Coordinating Council and the department. So not only was a group that reports to the county board created, but it also created a county department separate from the health department and supported by administration. So the health department and I are like siblings, if that makes sense, in like the hierarchy of things. And the point of the department, initially it was actually just a supervisor, and the supervisor was more or less kind of meant to be someone to help guide that group, that council group, and then also kind of to be a contract monitor for the different services that might come out of what the recommendations are from that group. So this is just kind of a breakdown and kind of the differences, because the health department also has its own mental health advisory board, which has a totally separate funding source, and does have someone to act as it's Amy Hopper's role, the behavioral health program manager. And then behavioral health coordination as a different department has its own separate programs. So we're related to the health department, but we're not in the health department. And it doesn't help. Our office is located in the health department building, so that's also part of some of the confusion. I mentioned that the health department by law does have a mental health advisory board that has its own separate funding committee that creates its own contracts and opportunities for funding. And because of the funding stream, there is no short-term chance that those bodies will be fusing anytime soon. A mental health advisory board is something that you'll see across a lot of counties. So that's something that has to stick by. And because we have this weird separate sales tax funding, that's why kind of this separate body exists. That's how I've felt about it for a long time, but don't worry about it, because I've done the work to get it figured out. So when this group started, we really initially had two main functions: providing administrative support to that coordinating council. And oh, you know what I forgot to add in here? Initially, it was staffing the frequent user system engagement program, or FUSE program, and then triage. We had what is now the Behavioral Health Urgent Care through Center for Human Services, started as a county program. So the department was initially staffing those two programs. As of this point, the biggest program that behavioral health coordination as a department has is still definitely the FUSE program. The council was holding quarterly meetings, creating work groups around different categories in the mental health action plan. I'm sure several people who are here at this table now were invited to several of those work groups. And those groups, not just the work groups, but also the large group, would discuss current issues in our community with the plan to collaboratively work on these solutions and propose ways that funds can be used to support the community. If we fast forward a little bit, and this is where we're finally back to March of 2024, McLean County Board Chairman Catherine Metzger paused BHCC meetings to be able to refocus efforts on coordination between its members. What was happening when all this happened? The too long didn't read version of it is that there were no ratified bylaws. And so a lot of the procedure parts were missing, as far as how does a funding request get added? What does even just like what the agenda looks like and what those follow-up pieces are. There was a very unclear process on how funding priorities were determined and how someone was meant to apply for funding. And we ended up using it as an opportunity to really more purposefully rebuild the coalitions that we've started. Anytime that I've talked about this group to a larger audience, like outside of McLean County or outside of Illinois, even though it has the natural human consequences of a large group of people from various backgrounds and different businesses coming together and sometimes disagreeing. Lots of communities have said, "Man, we couldn't get these people, a large group of people like this, at a table in like 30 years." So even though we do sometimes have, there's just differences sometimes that you'll see. The fact that everyone is still able to see that we have this shared vision for a better community that we live in and are able to use that vision to collaborate together. A lot of other folks have been impressed by. It's given us a lot of advantages as far as figuring out next steps. So after meetings were paused, folks from that intergovernmental agreement, the city of Bloomington, the town of Normal, and the county board ended up creating an ordinance to amend the parts of the county code that say what those groups are. And that ordinance passed in July 11th, 2024 this year. And it did three main things. So one, it established Behavioral Health Coordinating Council as an independent forum. So Behavioral Health Coordinating Council no longer directly reports to the county board, is an independent group. It provided some additional clarity around powers of that group and around membership, and it also created a separate funding advisory council. Now we're going to get into the dirty details of all that stuff. So independent means, as I mentioned, that the BHCC no longer reports to the county board. It is not considered a part of the municipal government, which means that Open Meetings Act statutes no longer apply to it. The group is still in the process kind of feeling out its bylaws. And our intention is certainly to make these meetings as transparent as possible. So as we get more information about that, even though it's not going to have all the same Open Meetings Act parts, because it's independent, what that'll mean is that basically we need new branding. We need new branding, and we'll probably have a separate social media presence. So there is going to be a unique opportunity for additional engagement or enhanced engagement with the public and with other entities because of that social media presence. Okay, that's the thing that I just said. I forgot that I added that to the side. So as far as what BHCC's role is in alignment with that ordinance and with the new bylaws, the BHCC is responsible for reviewing and updating the mental health action plan and then making recommendations about spending to the funding advisory council. The BHCC is meant to facilitate conversations about aspects of the community's behavioral health system amongst its stakeholders, like it already has been. And can also recommend policies to both public and private agencies for the generalized improvement of the behavioral health system so that we can help create systemic change. Particularly if you've been a little bit more, if you've been a part of BHCC meetings or if you've been paying attention to them, what that also means is that BHCC is no longer going to be reviewing specific funding requests. And when it comes to making recommendations for policies, BHCC is not approving, managing, directly planning, anything like that, any kind of individual agencies or departments' work. They can certainly use their shared expertise and their access to evidence-based practices to make recommendations, but there's no decrees that are going to be coming down from BHCC. The other thing that will likely be off their plate and more into the departmental side is the direct planning of the Behavioral Health Forum. Because of all of this goofy madness, we did end up postponing having a 2024 forum. And what I'm probably thinking it's going to look like, if it's going to be in my team's court, is breaking it up into at least two events. I'd actually like the idea of breaking up kind of what the subjects are of the events, or maybe what the audiences are, so that we can focus more on a couple of different audiences at different times of the year. But once I know something about that, you guys will. There are also a couple of changes to BHCC membership, at least clarity around who we wanted at the table. The largest representation in BHCC is definitely agencies providing human services. There are folks that are related to the intergovernmental agreement, and then we do have some non-voting administrative support roles. There were a few changes as far as who was invited to the table. There was a shift toward emphasis on representation from mental health agencies and other human service agencies. And what we're hoping is that with time that we'll be able to engage more with non-human service agencies as we grow our trauma-informed collective rise. I finally hired an assistant director in July. I think she started in July. And I finally hired a case manager to replace that assistant director this week. She had her first week. So I'm excited to let that person really give that person the support that they need to do event planning and to really give Rise the oxygen that it deserves. So hopefully more information coming out about that. I think I have a list. Why do I have that first? So the bylaws allow for 3 more agency reps. And the group is still actively considering what gaps it has in its current membership. So this is a list of which agencies are currently represented. You can see it's a wide variety. Some of it is psychiatric care. Some of it is inmate services. There's a good amount of youth services, family services, disability services, homeless services. So there is an opportunity for us to add more folks. We are not, or I guess the group at large is not in a hurry to invite people to the table yet, because they do want to be very mindful about kind of figuring out what is represented at the table and what isn't represented at the table. That being said, if you've got a group of people and you're interested, just reach out to me and let me know. What I've generally been recommending to people is that they take a look at the strategic priorities that they've identified that the BHCC has identified from the Mental Health Action Plan, which I do have included in these slides and will come out to you guys, and essentially kind of craft hey, this is what our organization does that aligns with that. This is why we think we would be a good fit for this table. The intergovernmental folks are a member of the Normaltown Council and the Bloomington City Council, a member of the McLean County Board. We do have a member from the 11th Judicial Circuit, who is also the facilitator of our meetings. It's Judge Rebecca Foley, who is filling that role at the moment, and then someone from the Regional Office of Education as well. Hey, if you saw yourself on that list, good news. I'm hoping, like I said, since we're going to have more of a social media presence, I'm hoping that there will be opportunity for social media entities from some of those organizations to have more collaboration, whether it's some kind of structured thing that we do together on social media. And I'm hoping to also be able to give these different organizations some sort of templated summary so that when meetings happen or when things are happening, that they have an easy way to disseminate that information to their larger group of people. I do think that these changes have made a great opportunity for us to really share, really take advantage of the collective knowledge of all of your organizations and not necessarily just one person who's at the table. There is some non-voting membership, which is just straight up county employees, including myself. So they are included in these meetings to help ensure that the county can provide adequate administrative support. So the county administrator is there, myself, the behavioral health coordinating department director, and the director of the health department. So the other part that this all brought together was the Funding Advisory Council. And the full name is Mental Health and Public Safety Fund Advisory Council. So The Funding Advisory Council is still directly connected to the county board, and their job is to provide formal recommendations to the board for budgeting those funds from a portion of that shared sales tax fund. So there's the 25% that is strictly represented within the behavioral health coordination department, and the funds that are made available for different community opportunities. And then a bigger chunk of that fund is more focused. Some of it is focused on some of the criminal justice aspects that we kind of started talking about. So some of that goes to the debt relief that went into the redo of the jail, those kinds of things. I mentioned that these are still connected directly to the county, which means that Open Meetings Act rules do apply. So these meetings will still be live recorded on YouTube. There will be clear Open Meetings Act related communication about timing, location, meetings, the agenda, and any kind of Open Meetings Act meeting also has to have an opportunity for public comment. The FAC membership is much smaller. It is the same Behavioral Health Coordinating Council representative from the town of Normal, the city of Bloomington, and the county board. And then there is one member from BHCC who is voted on by BHCC to join, and then one member from the Criminal Justice Coordinating Council who is voted on to join as well. If I remember correctly, the intergovernmental city representatives have 2-year terms, and that's for both FAC and for BHCC. And the body can move to reelect that person as the representative, but every 2 years they need to reassess who they want to be coming to the table. It is also still true that me and the county administrator are providing administrative support to this group, so helping to get together the agenda and all that kind of stuff. As far as where things are now, and this is slightly out of date because we actually the FAC met for the first time yesterday. The HCC chose Stephanie Barish, who is from the Center for Youth and Family Solutions, and the Criminal Justice Coordinating Council chose Sheriff McLean to represent them. Like I mentioned, we actually met yesterday instead of a few weeks ago. We will probably meet again. The ordinance requires that we meet at least once every year. And part of why everything is weird and different this year is because of the timing of when everything got shut down, because the county was decided to be the holder of these shared sales tax funds. The plan for what happens to those funds has to go through the process for county board that is included with the county board budget process. And that is happening imminently. That all has to be in the correct hands in 2 weeks. And so a lot of what is going to be happening this year won't necessarily be what it's going to look like going forward. As we get closer to figuring out how these funds are going to look, because the next, it has been approved, the budget, I think it was $1,500,000 that's been set aside for special projects related to community projects. Figuring out how we want to use the strategic priorities to split that is kind of the next big step. So I'm going to be the one to help the behavioral health. Well, won't necessarily be helping BHCC, but to kind of help get the right people at the table to figure out what best practices are and what the best use of those funds is going to be this year. One of the things that they got together to do in the summer was all of the Behavioral Health Coordinating Council folks got together and looked at the Mental Health Action Plan, which is very robust and very wide. And they created 5 main priorities that they want to focus on now through 2025. So going forward, this will probably be more of a, well, particularly it's time to update the mental health action plan. So I anticipate that the version of the mental health action plan going forward will be a little bit more like streamlined. I still want big picture stuff to get represented, but I want solid, shorter term actionable goals for us to be able to take action on. So what we've settled on for this next chunk of time is to increase public awareness and education about services, to increase accessibility for vulnerable populations, particularly families and justice involved folks, to increase safe shelter space. That includes behavioral health service integration and to innovate human service system recruitment and development efforts, as well as to create a group, probably a work group to explore different standards for interagency data collection so that it's a little bit easier for us to share information with each other as safely as possible while still respecting people's privacy. And that is what you can more or less expect is so the FAC has met and has proposed the budget. And then the next step is going to be, we're still in the process of figuring out kind of what that actually means on the ground for the next year or so. BHCC, what I expect their next steps to be would be just, honestly, it's just identity work. It's a lot of us it's just us getting back together and confirming that we do actually have a shared vision for this community, learning to trust each other a little bit, and figuring out how we want to support the current priorities. 2025 will likely be some good old-fashioned revision of the mental health action plan. And then I'm also hoping to be able to work with them a little bit on what they want annual planning to look like. Since I mentioned that it won't look like it kind of ended up being a bit of a scramble because of when all the pieces fell into place. So I'm excited for it to not feel like a rush. As far as what my department sort of does, because it is a little bit different, and I do directly report to the administrator, is the Behavioral Health Coordination Department coordinates with the facilitator of Behavioral Health Coordinating Council to plan meetings, send material. One of the things that it provides is continuity in the face of member turnover. So there is someone who knows the history of what's going on, can assist with orientation to new members. It's one of my primary roles to manage contracts, grants, and business agreements that were previously created by BHCC and now will be created by the FAC. Whether that means it's just me as a contract monitor or whether that means that we need to hire a person to be the system of care grant is a good example where one of the requirements of the grant is that there's a person that 75% of their job is just this grant. And then assistance with strategic planning support, community engagement, that kind of stuff. Generally speaking, as far as what behavioral health coordination as a department does, is it does, just like the council does, support collaboration between both private and public entities for the improvement of mental health in the community. And some of the more brass tacks stuff would be staffing and administrating specific programs and staff. So like the FUSE program, RISE, staffing and administrating different events, previously like the Behavioral Health Forum, and then any kind of other separately acquired grants and contracts. All, of course, that need to promote the tenets of the Mental Health Action Plan. We do have a couple of newer options for contacting us. I have left just my literal work email on there, but we do have a couple of generic emails that you can also reach out to that is going to hit more than me. So if I'm off or busy or can't get to your email, you're going to hit a wider group of people who are going to be able to answer your question. So the first one is MCBHC, McLean County Behavioral Health Coordination at McLeanCountyIL.gov. And then specifically, if you're looking for more information about the FUSE program, you can reach out to FUSE at McLeanCountyIL.gov. And that, I think, is all of the stuff. What questions do you guys all have?
Marita, I'm going to go ahead and chime in here real quick. First, thank you so much for your time and support with this presentation. It was very informative, and we greatly appreciate you being on here. Being someone that has been part of this ROSC Council for several years now, can you just speak a little bit more to how our ROSC can help support some of these efforts and how we can continue to partner in the days ahead?
Yeah, I'm hoping that is something we are honestly similarly comprised groups with fairly similar goals. And so ROSC did come up when it came to discussion about who should also be at our table. So I think that there will be some opportunities for that. It is unclear to me at this point specifics as far as how we can contribute and how you guys can additionally support, but as we start to get as the group starts to kind of understand who they want to be a little bit more, and what next steps might look like, I think there will be some great opportunities for collaboration, whether it's around events, whether it's around social media presence. So I'll definitely keep you guys tuned in as far as, and it might even be presenting about that piece, because it is only kind of one, recovery is definitely one big piece of just generally behavioral health, period, just period care. But I do think, I don't have specifics, but I do think, I agree that there's some excellent opportunities for collaboration.
Beautiful. Thank you. Does anyone else have any other questions for Marita before we move on today? All right. If there are any additional questions, again, her contact information is right up there on the screen, and we will be sending along a handout that Marita provided to us with the meeting minutes as well for each of your reference. So Marita, thank you for being here. We again appreciate your conversation and PowerPoint today. And then Kat and Barb will go ahead and turn it back to you.
Thank you, Carrie, and thank you, Marita. That was really great information. Good information to know, and looking forward to learning more and working with you. And I'm not sure if who's sharing our PowerPoint. I'm not sure if Carrie or Kat is.
I'm getting it pulled up.
All right.
All right. So with the last half hour we've got, we wanted to go ahead and jump into a couple of updates we've had on different things that our team has been working on, but also the planning committee. So as we've been doing kind of the shift and what we're looking at from going from more direct programming to more efforts to implement community-wide systemic change, our planning committee is we've also been having conversations about how do we want to grow and evolve into this new space. So just a couple of updates on some of the things we've been discussing. We are discussing utilizing the planning committee as a sort of onboarding committee. And that would function in a couple of different capacities. That would be anyone who is interested in joining the McLean County ROSC, especially as a council member, they would be able to meet with us, and it would be a space of like, come learn about ROSC. But going a little bit further than that, we're also talking about utilizing it and collaboration brainstorm space. So we might Carrie, Barb, and I, and if it's something that they want to move a little bit further with, it could be handed off to our planning committee. Something else that just kind of came up that the ladies were interested in is a newsletter. So that has been a little difficult over the past year because we've been getting pulled in so many different directions, but we're looking at trying to get a Q1 of FY25 newsletter, hopefully out by before our next ROSC Council meeting, or if nothing else, with meeting minutes after the September meeting. And then I'll kick it back to Barb, and Barb can tell us more about what we're looking at doing for Recovery Month.
Thanks, Kat. And okay, so Recovery Month is right around the corner, September. I can't believe we're already in August. But what we have been working on is partnering with a New Horizon, the Recovery Community Center here in town. And we are looking to partner with them and do Recovery Month reading displays at our local libraries. And we are wanting to branch out this year to high schools. Last year we did this. We did community libraries, not all the college libraries, but we're wanting to hit all of them, and then the high school libraries. And basically, there will just just have a display of different recovery books and resources. We would have Narcan and probably like the disposal bags, the Terra, I think, and things like that. And we're also would love to hear what you're doing for Recovery Month if anything's being planned, but that can be when you give your updates. And then Kat, do you want to talk about the history of substance use treatment and recovery in Victorian times, since this is
Yes.
your baby?
Yes. So, I have done in the past at different steampunk conventions the history of substance use treatment and recovery in Victorian times. I presented that for the students at Heartland in fall of 2022 when I was a student. And we're looking at doing that again. Another fun little aside, this is not anything I'm doing work related, but I will be presenting this presentation at the Bloomington Public Library the last weekend in September. I'll send more updates about it on my own time, and you guys can come learn about some of our very interesting history of how we evolved to the work we have today.
Awesome. I'm excited. So, last weekend in September, and you'll have more information
Yep.
in the future. Okay. Sounds
Yep.
good. Thank you. Okay. And I will go ahead and go over this big, huge National Recovery Rally is coming to Chicago, Illinois, actually this year. So we are lucky to have the National Recovery Rally, and it is on September 21st, as you can see here. And if you can get that QR code, it will take you to all kinds of information. This is a national rally, and faces and voices are a big part of this. And we hope to see as many people as possible in Chicago on September 21st. There's going to be lots of fun things to do and talk about recovery. And I think we can go to the next slide. I'm not sure. And then, yeah, Kat, I think you can go from here.
Yeah, so we've got a good 20 minutes before we wrap up. We just want to turn it over to you guys. We want to know what's going on in the community. What's the haps? What are you doing for new resources? What are you doing for events? Especially as Barb mentioned, if you've got anything you're doing for Recovery Month, we would love to know so we can promote it.
Go ahead and jump in. Hello everybody. My name is Armando Miranda. I am a prevention specialist with AMI Youth Services, and I have an exciting event coming up on September 19th. I'll drop a link to it, and I'll send the flyer in the chat. We are partnering with the Glenbard parents. And so they have a speaker come in every month. And for September, they're bringing on Chris Herron, who is a former NBA basketball player. He has his own recovery story, and he is now just a public speaker, someone who gets out into the community and speaks with parents about kind of the intersection of sport, injury, and his own personal life and his road to recovery. And yeah, we're really excited if you all can join. It is hybrid. If you find yourself in Glenbard, you can attend in person, where they are raffling off some Bulls tickets for those attending in person. But more importantly, it's available online as well. And I think just a great opportunity, yeah, just to connect and hear a really great story for the month of September. We also have on our website some resources for educators, for parents, anybody in the community, really. Starting in this school year, teachers, or I guess like health classes, are required to have a kind of fentanyl component to their health education coursework. And so we are offering an ISB accredited course, an Illinois State Board of Education course that they can take through our online course. We have this thing called oh my God, I'm blanking on the name. The link is on our website. We have our own kind of online resources for classes that can just be taken, online. And we have both an educator course and then just the accompanying curriculum for students as well. So I encourage you all to take a look at our website, look through some of our resources. If you know any health educators, yeah, just go ahead and take a look.
Thank you, Armando. That sounds awesome. And I've heard of Chris Heron, and I've watched a little bit of him speak, and I think that will be amazing. So that's really exciting, really exciting. Thanks. Anyone else?
I'm gonna give you a few events, not necessarily related, but I sure think that ROSC members could show up and show out.
Okay.
This weekend at Miller Park from 12 to 4 or 6. They usually end up at about 4, is Cultural Fest. And so I think that would be a good one to show up for. Then on the 14th of September is WBRP's Harvest Fest. And that will be at the WBRP there from 2 to 5. And then on the 15th, it's the city's, it's welcoming week for immigration and refugees, and Diversity will be at Miller Park from 10 to 2, and it's free zoo, free bounce houses, free food, free putt-putt. The bookmobile will be there, most importantly. It's another good one to promote, and I can get the flyer to you.
What was that second one you had mentioned, Michelle?
WBRP's Harvest Fest, West
Thank you.
Bloomington Revitalization Project from 2 to 5.
I just want to say, Michelle, we always appreciate you sharing stuff. You are always a font of knowledge of what's going on in the community.
Thank you. I enjoy it.
Indeed. Thank you.
Can I go ahead and give you another one, because I really feel like
Sure.
this one hits your spot, and it could you might need to know about it in advance. It's on October 12th, and Blue Cross Blue Shield is having health screenings at Eastview Community Center from 10 to 2, and there's going to be a lot of things like face painting and food, and there's going to be a lot of healthcare related things there, tables, etc. So that might be another one for you to consider.
Thank you, Michelle. Did you say that's at the Eastview in downtown Bloomington?
It's the old YMCA. It's
Gotcha. Yep.
yeah,
Okay.
the community center.
Thank you.
They're the ones that own the property where Tent City is.
Yes. Yes.
Mhm.
Yeah. That was a great spot. There was the that one event there. I'm drawing a blank. Was it the Reentry Council put?
Yes. Yeah.
Yes. Yeah.
Mhm.
That it's a great spot. So
It is a good spot. Location, location, location. If you have an
yes.
event you need to have, that's a good place to have it.
Yeah. Thank you.
All right. We'll go ahead and wrap up a little bit early. So our next meeting is going to be Tuesday, September 17th. And we will be meeting virtually from 3:30 to 4:30 p.m. As you have probably learned from some of our emails within the last month, we have a new Zoom code. So we're in the process of getting that updated on different things where we share our information. But I have taken some of the feedback from you guys, and as you could see from emails between yesterday to today, we're trying to make sure we get those reminder emails like day before and day of, just so you have that quick little reminder, oh, hey, we're meeting for ROSC this afternoon. So, and as always, you can contact any of us via our email. Our general Gmail account is mcleancountyrosk@gmail.com. And we loved having you guys out this afternoon to learn more about what's going on as far as higher level of what's been happening with behavioral health coordination. And we look forward to seeing you guys soon. So we'll conclude our meeting for today.
Thank you, everyone. Thank you, Marita, too, and all. We'll see you next month.
Bye, everyone.
Bye-bye.